Hey everybody. So this week we've been looking at how do we actually treat people that have abnormal disorders, and we've been talking mostly about the psychotherapies, which are also known as the talk therapies, and those kind of feed off of most of the perspectives we looked at. But in this video we're going to be focusing on the biomedical theories, which take the biological or neuroscience perspective and see disorders as having this organic physical root, and they can be treated regarding that physical organic root. And then these are like the three main categories of treatment in the biomedical model. We have the drugs, which we'll talk lots about, electrical stimulation, and surgery. Before we begin the specific treatments, I think it would be good to do a quick review of basic research methods, because when we're talking about using drugs or other medical treatments, they need to be tested to make sure that they work first. And so most drugs are tested and should be tested in what is a double-blind procedure where neither the researcher nor the participants know who is in which group, and tested against a placebo. Again, this is important to determine, is the drug effective, what's its efficacy, is it going to work, or is it just a placebo effect? It's also important to know that some therapists see these medical treatments as the only option, and they should not be used in combination with the psychotherapies, but there are a lot of psychologists that use talk therapy along with these biomedical treatments together. Another thing to keep in mind is your brain is very good at keeping out foreign invaders. We talked about that blood-brain barrier when we did drugs. So all of the drugs that we're going to talk about today can get past the blood-brain barrier, which also means they can get past the placenta as a teratogen. But it is a challenge to develop drugs that are able to successfully cross that blood-brain barrier and affect our mental processes and behaviors. And lastly, just a quick review as well, only psychiatrists can prescribe medication in most states. If you're a psychologist or if you have a PhD in psychology, you cannot prescribe medication. Now those people can do the talk therapies, but they can't actually prescribe drugs. However, some states are now passing laws saying that licensed psychologists can disperse medication if they complete special training. So I read online the other day that Illinois just passed a law that all psychologists can prescribe medication now if they don't have their medical degree, which has spurred some controversy as well, but that's just a quick review before we get started. So the first category of biomedical treatment is psychosurgery, and just as it sounds, this is when you do surgery on someone's brain in order to affect their mental processes and behaviors. The most famous being the lobotomy, which we talked about in class at the beginning of the unit, and if you missed that, I have the video on my website that you can check out, but essentially, you shove the ice pick or instrument in behind the eye, scramble your frontal lobes around, and the person comes out nice and sedated and calm and not psychotic anymore because you just severed lobes and all these connections and destroyed parts of the brain. Thankfully, though, that does not happen anymore, and psychosurgery in and of itself is very rare because we have drugs now that are seen as the preferential treatment before surgery just because they're less invasive. However, for epilepsy, like sometimes we'll go in and sever the corpus callosum, and sometimes severe obsessive-compulsive disorder, people will go in and mess with some of their limbic system. But again, it's very precise and exact. We're not just scrambling around instruments inside of your brain anymore. So now that we've covered surgery, we're going to move on to the drug category of biomedical treatment. And there are several categories of drugs that are used, but we're first going to start with the antipsychotics or neuroleptics. And just like the name says, antipsychotic drugs are meant to cure psychosis disorders. And psychosis is a departure from reality. So hopefully you're all thinking that antipsychotic drugs are for schizophrenia spectrum disorder. That is the disorder in which people really lose touch with reality because of their hallucinations and delusions and all the other symptoms that come with it. Now, as we talk about these drugs, it's important to keep in mind that finding correct dosage is incredibly difficult, and it's incredibly important because a lot of times on the news we'll hear about people who, kill themselves or murder other people or, shoot up schools have had a bad dosage of their antipsychotic or their antidepressant or anti-anxiety drug, and so it's really difficult to find it, which is why a lot of psychologists choose to do the talk therapies. However, with something as severe as schizophrenia, a lot of times it's worth the cost to be on medication because they have such severe symptoms that the side effect risks of these drugs are worth it. So let's take a look at these drugs. What you're seeing here in the black, the haloperidol, chloropromazine, risperidone, and clozapine, those are the names of the actual substance of the drug. The names in gray, the haldol, the thorazine, risperidol, and chlorazil, those are all the names in which the drug is marketed. So like, when you see a commercial for a certain drug, like Claritin, that's not the name of the actual drug, but that's just the name of the marketed drug that they're using for it. So I just want to make sure you have all these names here. The first two are what we call the old psychotics, and they were developed originally in the 60s, and they were heavily responsible for reducing the amount of patients that we had in psychiatric hospitals. Because their positive symptoms were now being reduced, they could leave the hospital and function a lot better. So this was a huge reason for that. This also led to the decrease in lobotomies because people didn't have to have this invasive surgery anymore. They could just stay on an antipsychotic. These are no longer the first choice because they do have very serious side effects, but if the bottom two don't work, people will sometimes resort to these top two. What these drugs do are they specifically are dopamine antagonists. So if you remember from the brain unit, our antagonists are neurotransmitters that inhibit neural firing. They stop neural firing, and so they prevent dopamine from being released into the synapse. And as you'll notice from your free response question that you'll have for this test, which is all on dopamine, all on schizophrenia, there's a dopamine hypothesis, which a lot of psychologists say that the cause of schizophrenia is when someone has too much dopamine being produced in the brain, or they have too many dopamine receptors. And so these drugs specifically target the dopamine receptors so that we can reduce those positive symptoms of hallucinations and delusions and getting out of reality. The bottom two drugs are what we say are our new psychotics, and they also affect dopamine but other neurotransmitters as well, and they also affect negative symptoms like the flat affect or the catatonia symptoms. So here's a quick graph that shows you just what the old psychotics did in reducing the number of people that were in mental hospitals due to psychosis before the drug was created. The problem is, though, that because the drugs were cheaper than mental hospital stays, they would put people out of the hospital on the drugs, but if the people didn't take the drugs, then a lot of them ended out on the street, and this is where we get a lot of the homeless stereotype of schizophrenia, because if they're not in a hospital, there's really nowhere else for them to go if they're not taking their medication. The side effects of these neuroleptics, though, as I mentioned earlier, are very great. Things like dryness of mouth, involuntary jerky movements, weight gain, which is especially difficult for younger people who care about their weight, sexual side effects, which definitely hurts marriage relationships. And then the biggest side effect that I want you to remember is this long-term side effect called tardive dyskinesia. And this is when you've been on a neuroleptic or an antipsychotic for a long period of time, and you'll get these like involuntary tics, movements in your face and in your tongue. And because these antipsychotics are toxic to your brain, and over a long period of time you get these side effects. And even if you stop taking an antipsychotic, this tardive dyskinesia can continue on. And so I think this was actually on the question of the practice AP test that we took not too long ago. So definitely related to the schizophrenia and the neuroleptic drugs. So scary side effects, but they're worth the cost for many patients with schizophrenia spectrum disorder because the disorder itself is so severe. Our second category of drugs are the antidepressants, and hopefully, as you can tell from the name, these are for people with depressive disorders. And the drugs that we use are called SSRIs, or selective serotonin reuptake inhibitors. And people with depressive disorders usually have a lack of the neurotransmitter serotonin, which directly impacts your mood. And so what SSRIs do is they allow more serotonin to be produced and also included in the synapse. So if you remember from the bio unit, when an action potential occurs between two neurons, you have neuron 1 that spits out neurotransmitters into the synapse. Neuron 2 sucks up those neurotransmitters, but whatever doesn't get sucked up by neuron 2 gets retaken back up into neuron 1. And so what these drugs do is they prohibit neuron 1 from reuptaking the serotonin into the neuron itself. Therefore, the serotonin is now flooding the synapse, thus altering someone's mood. So these are drug agonists. They increase the production of serotonin. They increase the neural firing of serotonin. Common SSRIs that you might have heard of are Prozac, Zoloft, and Paxil. And so here's a picture that kind of shows you what's actually going on with an SSRI. You can see here the first neuron is releasing serotonin into the synapse. Here reuptake is starting. That would be without an SSRI, but what an SSRI does is it blocks this reuptake so that serotonin now has to flood the synapse, thus impacting somebody's mood. The third category of drugs are the mood stabilizers. This is specifically for people with bipolar disorder because it stabilizes the extreme fluctuations in mood and energy in the disorder. And what we use is this salt, actually called lithium. It's a very cheap salt, and for some reason it stabilizes the bipolar symptoms. Psychologists actually really don't know why lithium works the way it does, but they still use it because they get results, and it's very cheap, and it seems to be effective, which is kind of scary. Hopefully it's not actually causing anything bad, but it was the same attitude with the lobotomies in the 50s. We don't really know why this is working, but it's working, so we're going to keep using it, and then we realize, oh, we're kind of destroying someone's brain. So I don't really know if that's the case with lithium, but sometimes in science we still use things that we don't have a lot of explanation on, but we're getting results for them. Our last category of drugs are the anti-anxiety drugs, and these are also called tranquilizers because most people with anxiety disorders have high autonomic arousal at all times. And so what these drugs do is they seek to depress that high autonomic arousal and give them some relief from that. So some anti-anxiety drugs that you might have heard of before are Xanax, Valium, and Librium. And one of the important things to remember about anti-anxiety drugs is because they are a tranquilizer, they're a depressant, that you shouldn't mix these with other depressants like alcohol, for example. People have to be very careful about this because they can have a synergistic effect. And the other thing about these anti-anxiety drugs is that they create dependence. So antipsychotics and antidepressants, most people can't get addicted to them, but you can become addicted pretty easily to anti-anxiety drugs. So doctors have to be very careful when they're prescribing these. A lot of abuse comes from anti-anxiety drugs, so people who really don't have anxiety issues will seek out these drugs to get high or to mix with alcohol to create a high as well. There's some criticism about these anti-anxiety drugs because a lot of times they're prescribed on a continual basis when all they're doing is they're curing the symptom, they're not curing the cause. Okay, so if someone is constantly anxious about something all the time, this doesn't fix what they're anxious about, it just quells their anxiety. And so behaviorists would much prefer that we go to the cause and use a behavioral therapy like systematic desensitization or we use cognitive behavior therapy to change their thinking about why are they anxious about the situation rather than having them be on this potentially addicting drug that could affect them the rest of their life. And a lot of times you can get these anti-anxiety drugs in single or double doses where like if you have a fear of flying and you only need to fly like one time to go see a family member, a doctor can prescribe you a single dosage of a Valium or Xanax or two if you're making a round trip flight and then it's done for. But if you have a severe fear of flying and you have to fly all the time, then it might be better for you to go see a behavioral psychologist to get the fear of flying dealt with because you don't want to be on anti-anxiety drugs the rest of your life because they're not that good for you in the long term. Okay, our last category of biomedical treatment is electrical stimulation. And so there are several ways to use electricity and magnetic fields in order to try and impact someone's mental health. So the first one is called ECT, or electroconvulsive therapy. And this is usually a treatment of last resort for depression. And so essentially what they do is they sedate somebody and they electrocute their brain. Essentially they put electricity in there to try and cause activity to happen and to cure their depression. And strangely enough, there are positive results from this treatment for people with serious depression. The only side effect being that they have some retrograde amnesia, so they'll forget what happened like right prior to the procedure being done. This is another instance where psychologists really don't know why or how this works, but it works, and so they keep using it. Again, it's kind of scary for other psychologists because they're like, well, you're just zapping somebody and hoping that it works, but you don't really know why, and there could be side effects, so controversial method for sure. RTMS is a little newer method that's not as dangerous, and this is depicted in this picture here. This is when you have a magnet basically over your head, and what it does is it pulses magnetic field into your brain to stimulate activity in your left frontal lobe, because people with depression usually have low activity there, and so this is supposed to spur the activity and hopefully pull somebody out of depression. I do have a video of this on my website if you want to kind of see what that looks like. The last two, vagus nerve stimulation and deep brain stimulation, as you can see in these two pictures here, are another way to use electricity to stimulate the brain. Vagus nerve meaning they go through the vagus nerve, which runs through your neck all the way down to your stomach and all the way up to your brain. By stimulating that, sometimes they get results for people with depression. And then deep brain stimulation, they actually drill into your skull and implant electrodes in there, attach those electrodes to like a pacemaker type thing that's in your chest, and from time to time you can generate an electrical pulse from the pacemaker into your brain, thus increasing the brain's activity. Again, this is a very invasive procedure used as a last resort, but they seem to get some results from it. So I also have another video online of a woman who received deep brain stimulation as a treatment for her depression and found it to be helpful. So take it or leave it, but those are the three ways that we use electricity, I guess, to impact mental health. Okay, so just a quick recap for this video. We did surgery, electrical stimulation, and the drugs. Our test is going to be on Monday, which is tomorrow for most of you watching this. So review this, and I have other review stuff on the website as well, and I will see you tomorrow.